Okay, well, welcome everybody. It's nice to see all this huge crowd right here. It's amazing how much we've grown in the past 15 to 16 years. And welcome to Denver, Colorado. Beautiful out there. So actually, my last memory of Denver actually is at this hotel, and I know that there are people out there in this crowd who remember one of the last times we were in Denver. I actually thought that this was 2005 was actually the last time that we were in Denver because we stayed at this lovely old hotel, which I believe still exists, and I can't read it from here, but this is an ad from the 1950s that said that the hotel is now fully air-conditioned, and I believe it's like something like $6 a night or something like that. And we spent several CARRA meetings there, but in this particular meeting, we had this unfortunate experience of, in May, having a surprise blizzard the morning that we were all supposed to leave. And I believe that almost everybody who attended had to stay in Denver for another 3 days. So, so I actually thought that we were so traumatized that was the last time we were in Denver, but we just found out that we actually had 2 more meetings after that in Denver. But it's nice to be back. So this is our 14th annual meeting, and we have, I think Kelly said, actually over 480 people registered. So it's our biggest meeting ever. And actually, you can see back in 2005, which is over here, that we had actually only about 75 people attending the meeting. So we've really grown by leaps and bounds, and in blue is the membership. This year, we actually have 83 separate meetings, including 34 work groups. And actually, we've been working hard already. Tonight is the opening session, but we've been having many pre-conference meetings and workshops today and yesterday, including a Research 101 course, a pediatric ultrasound course, and all the CARRA cross-cutting committees, that is, committees that are not disease-specific, all met today as well. And we had a fantastic orientation for patients' parents, and also a resident orientation. And I believe we had a record turnout for patients and parents as well. So I just want to go over some meeting highlights with you. Starting early tomorrow morning, we have at 7:30 in the morning, we have our keynote speaker, who's going to be Professor Ramanan, who is from Bristol and is the chair of the UK Clinical Study Group. And he's going to be talking about uveitis trials in the UK and what we've learned from them. So he's going to be discussing the Sycamore trial, which was published recently in the New England Journal, and how that will impact pediatric rheumatology research in the future. And tomorrow at lunch, we have our lunch symposium on systemic JIA and lung disease, which is sponsored by Novartis. But I do want to point out that the Arthritis Foundation is providing the lunch. And we're going to have a panel of speakers, including Vivian Saper from Stanford, talking about the large case series that they put together of patients with systemic JIA who have developed serious lung disease. And then we have Steve Abman, who is the director of the Pediatric Pulmonary Hypertension Service at Denver Children's, and Robin Dieterling, who is the head of the Childhood ILD Network, as well as a pediatric pathologist, Gail Deutsch from Seattle Children's. And then tomorrow night, we have actually a session that highlights patient researchers. So in a session entitled Enhancing Members' Conception of Patient-Centered Research, and we have Jen Hornjeff, is a young adult with juvenile arthritis, who's going to be talking about advocacy and empowering patients to take part in research. And then Dana Lewis, who is a young adult actually with type 1 diabetes, who decided to take matters into her own hands and actually invented an artificial pancreas. So this should be a very interesting session and one that you should all attend. And immediately following that, we have the Arthritis Foundation sponsored welcome reception, which is also our poster session. So we're going to have, I think it's right next door, we're going to have all of our posters up and our poster presenters, as well as some nibbles and drinks for all of you. So please be sure to come to that. And Saturday, the plenary session is going to be given by Deepak Rao, who is the head of the Brigham and Women's Hospital Immunology Service, who is going to be talking about big data and using big data to learn about rheumatoid arthritis. At 1 o'clock, there will be a plenary panel discussion, which should be really very interesting and useful. It's going to be basically a panel of people who have successfully used the CARRA registry data and how you can also take the opportunity to do some analyses and research using the CARRA data. And then, of course, we have the CARRA dinner, which is a not-to-be-missed event. On Saturday night at 7 o'clock, we'll have dinner and awards, followed by line dancing, which has become a CARRA tradition, apparently. So here we see some line dancers from last year having fun. So don't miss out. And then the meeting will end on Sunday morning with a plenary session which will feature the oral abstract presentations. And then we'll have an interesting session which is basically reflections from meeting attendees. We'll have parents, patients, early investigators, fellows talking about their experience. And then we'll have some final thoughts from Christy Sandborg. I just wanted to point out that we have two registry data and wiki workshops. One is on Friday morning and one is on Saturday morning. And they're both going to have the same topic, the introduction to analyzing CARRA registry data. But on Friday morning, in addition, there's going to be a wiki tutorial with a Q&A session. And then on Saturday, there's going to be a session about the CARRA site feedback report, so hands-on session to learn about how to use that. There's actually a table in the back which has the list of the actual things that are going to be occurring at each of these sessions. So if you're interested, please take one. You do not need to sign up, and if you are going to come, you should bring your laptops. I also want to encourage all CARRA members to come to the CARRA business meeting. This is a members-only session that will occur on Saturday at 2 o'clock, 2:15. And in addition to the usual updates in terms of leadership, staff, and finance, we're going to have some important topics to discuss relating to the CARRA strategic framework team that has been working very hard to come up with some ideas that we really want your feedback on. So we really need you to come and join in the discussion and provide your feedback. Just want to say thank you to the Strategic Framework Committee, which you see listed here. Christy Sandborg is the committee chair. Lee White is on the board of directors as well as a patient and parent. We have Vincent Del Gaizo, who is a patient and parent, who will be speaking to us later in this session. Susan Kim, Peter Nigrovich, Lisa Wampler-Muscardin, who's representing the steering committee, Rob Fulbrigge and Emily Von Shaven from the executive committee, and Laura Schamberg is representing the registry oversight committee. And then, of course, we have Kelly Muskowski, our executive director. Carol Wallace, the chair of the board of directors, and I are ex officio members. And we also want to thank Cassie Solomon and her team for facilitating the work that we've been doing. So now I want to take some time to go over where we are in 2018 and what we've accomplished so far. So here we were back in, I'm actually not sure exactly when this photograph was taken, but I think it's maybe 2002, I want to say. And these were the people that sort of got together to really start talking about the formation of CARRA. And I think that, I hope that you can recognize most of the people in the photograph, even though, you know, we've probably gotten a little older and grayer looking, although I think Norm still looks the same. I mean, he's always looking. So here we were in 2003, and here are initial logos that we came up with, which I think Betsy Mellon's daughter and Christy Sandberg's daughter had some hand in developing, and the CARRA Registry logo. And here we are now, which is pretty amazing in a very short amount of time. But, you know, this isn't, our accomplishments aren't really just about numbers. We've really done a lot in a very short amount of time. And I think I probably have shown you this timeline before, but I just wanted to point out a few things. So this represents, you know, in the relatively recent past, what CARRA has been doing. So this is in the period from about 5 to 10 years ago. We had really accomplished and done some very important work, including completing the APPLE trial, which was the first randomized controlled and largest study of pediatric lupus that has ever been done. And we also completed the TREAT JIA trial of early aggressive therapy, as well as the RAPPORT trial, which was the study of rilonacept and IL-1 inhibition in systemic JIA. But I kind of like to think, in addition to these accomplishments, this time period being kind of the birth of the CARRA registry, or at least the legacy registry. So right around the beginning of this time is when the FDA held its pharmacosurveillance and JIA registry workshop, where we really got the idea that we really need to study the long-term safety of the medications that we use to treat our patients, and that in order to do so, we would have to start a disease-specific registry. And also in a similar time frame, there was the NIH ARRA funding, which gave us the opportunity to begin the CARRA registry, the legacy registry, and to build the infrastructure for that registry and begin to enroll patients. And that also, actually the same funding opportunity, a different grant, the Challenge Grant also funded CARRA to think about how we might study comparative effectiveness for the treatments that we use for our diseases, and that actually was the birth of the CARRA CTP concept, and we were able to develop CTPs for 4 major pediatric rheumatic diseases, following which we were able to do pilot studies for those CTPs using the registry. The registry, the legacy registry itself actually ended in 2013 when we ran out of funding, but that ushered in the new sort of era, the last 4 or 5 years of CARRA, where things really started to happen. And I think that the beginning of all this was our decision to form a 501c3 or become a nonprofit organization. This was the first time that CARRA became a legal entity, and prior to that, you know, we weren't able to actually take in funding ourselves. In addition to that, we were then able to begin our partnership with the Arthritis Foundation, which was a huge milestone. And in addition, we were able to get funding from pharmaceutical companies to begin our post-marketing safety registry. So all of these things put together really enabled us to start the new CARRA registry in the middle of 2015. And that really launched many of these projects and initiatives that you see here today that we have started in 2017. And actually, if you go to 2018, you can see that so much more is happening. So in terms of the major research activities that CARRA is involved in, I talked about the phase 4 pharmacosurveillance studies, and we are now also doing comparative effectiveness studies on a large scale of our CTPs for polyarticular JIA and for systemic JIA that I'll talk about in a minute. And we were able to start our first registration trial, the ANASTIL study. And we are working on validating patient-reported outcomes in JIA and lupus through the PEPPER study. And in addition, we are doing translational research in a number of different disease areas. And we're beginning to do some work in quality improvement and co-production of healthcare through a number of different initiatives, including a project that the Arthritis Foundation is funding through the Dartmouth Institute, and the UCAN Can Do collaboration, as well as a new PCORNet funding opportunity that we're working with the Arthritis Foundation and PR Coin. We're continuing to develop consensus treatment plans in many different disease areas, and we are continuing to expand greatly our patient engagement projects. And last but not least, we have been able to expand on the Arthritis Foundation CARRA Intramural Grants and Awards Program, which is very important. Now, to talk a little bit about the registry. So the CARRA registry really has become a cornerstone project for CARRA. And here you can see the sites for the CARRA registry listed by degree of enrollment. We launched enrolling just JIA patients initially in July of 2015. And in March of last year, we were able to start enrolling lupus patients. And now, as of December, we have been enrolling JDM and polymyositis patients as well. So our registry enrollment has continued to grow very, very nicely, and we are actually up to, I know you can't see this, but right now we're actually up to over 5,000 patients, which is pretty amazing in a short period of time. So our goal is to be able to enroll at least 10,000 patients who we will then be able to follow for at least 10 years. And so we're going to, by being able to do that, we're going to learn so much about our patients' diseases, their outcomes, and certainly, especially, about the safety of the medications that we use to treat our patients. So as of April 6th, we have 5,300 patients enrolled, 4,700 of whom have been confirmed to have JIA, 178 lupus, and 6 JDM patients. And we're going to be beginning scleroderma enrollment in limited sites very soon, and we'll be adding data elements to capture some disease features of Sjogren's and TMJ disease. And we are also planning to begin an autoinflammatory diseases registry. Also last year, we established the CARRA biorepositories and decided, after looking at a number of different biorepositories around the country, and chose Cincinnati Children's for US sites and Toronto Hospital for Sick Children for the Canadian sites. And in addition, we are collecting biosamples to accompany our clinical studies in STOP JIA, as well as FROST, and PROMOTE, which is a study of methotrexate pharmacogenomic predictors of methotrexate response in poly-JIA, and in the SCORE study, which is funded by the Scleroderma Foundation, looking at biomarkers in localized scleroderma. So this was the list of major research projects that I listed initially, and just to show you how important a foundation at the CARRA registry is, this is in blue, all of the different projects that have the CARRA registry as a foundation for data collection. So the registry is obviously a very important project for CARRA that we need to continue to improve upon and expand and make easier for sites to enroll patients. And one of the things that we did recently was to solicit applications from sites, CARRA sites that were not registry sites currently, who would like to become registry sites, and out of that we were able to choose 11 new sites, 9 of which are in the US. You see them in red on the map here. 1 Canadian site, and actually we are opening a site in Israel as well. So that brings up the total to 72 sites who are enrolling in the CARRA registry. The CARRA Arthritis Foundation Coordinated Pilot Program is, I think, a really important project as well that is just about to start. And this is a project arising from our understanding that, you really need to have research infrastructure support in order to be able to enroll successfully in the registry. So both large and small sites alike, if they don't have, even if there are 10 pediatric rheumatologists at a site, if they don't have support from a research coordinator and data entry, et cetera, it's really difficult to enroll patients. So this is a project that, in which we give a small amount of money to each of these sites in order to get started on funding a research coordinator. And the idea is that the funding goes for a year, and that the sites have to come up with a way of being able to continue supporting that research coordinator through enrolling enough patients in the registry to support that coordinator. And these are the sites that were awarded this program. We also have enhanced features for the registry for the sites, so that we have programmed automated reports about the JIA patients enrolled at each site, with information such as what kind of JIA the patients at your site have that are enrolled in the registry, the disease activity measures, what kind of medication usage occurs in your site, including use of steroids, adverse events, and this is all benchmarked against the rest of the registry, so you can see what your site is doing compared to everyone else. And this is something that's also in development for lupus and JDM, and I believe the lupus one is going to be launched within the next couple of months. So what are we planning for the future? As I said, we're going to be adding other disease states to the registry. We want to enroll at least 10,000 JIA patients and follow them for at least 10 years, and we have a long-term follow-up plan in place so that we can continue to follow our patients even if they transfer to another center that doesn't participate in the registry, or they're lost to follow-up, or they transition to adult rheumatologists, because JIA doesn't stop when you're 21 years old. We know that we want to be able to follow our patients for a longer term to find out how they do and what adverse events they might experience. We want to add more phase 4 post-marketing studies to our registry program. We want to embed more and different kinds of research studies, including interventional studies and other comparative effectiveness studies. We want to be able to enable patient co-production of healthcare, which is what we're doing with the Arthritis Foundation and PR Coin in the co-production project through the Dartmouth Institute. And we want to continue to and increase our biosample collection. For example, we're going to be starting JDM sample collection later this year or very soon. And we're going to be collecting scleroderma samples. And we do want to expand a biosample collection and also do more translational and basic research in the future. I also want to say a few words about our CTPs, which are an important and unique CARRA concept, because this year we've really done a lot in terms of trying to standardize not only the treatments, which are the CTPs themselves, but the process by which people are creating the CTPs. And this is, so this is just a little diagram that shows the rather, rigorous process by which the CTPs were originally created in order to be able to use them for comparative effectiveness research. And, the idea is that it doesn't stop there. Once you complete the CER study, you still, at that point in time, it's an iterative process, and you'll be able to see which CTPs are used or not, and which CTPs result in better outcomes. So the STOP JIA study is a large-scale CTP study that we're currently conducting of the polyarticular JIA CTPs, which is really trying to answer the question of when is the best time to start biologics in patients with new onset poly-JIA. So basically, these CTPs vary in when you start a biologic compared to DMARD. And we're actually almost completed with enrollment and currently have over 340 subjects enrolled out of the 400 that we need. And we've collected 82 samples, biosamples, for the companion Precision Decisions to Stop JIA project. The FROST study is the other CER study that we're doing of the CTPs, and this is looking at comparing biologic versus non-biologic treatment in new onset systemic JIA. Currently, we have 28 patients enrolled. We need 200, and we've been able to collect 12 biosamples for this study. So just to show you the breadth of the CTPs that have been sort of finished so far. In addition to these two CTPs, we also have CTP in lupus nephritis, as well as 3 in dermatomyositis that have been published, and 1 for localized scleroderma. In development are all of these other CTPs, and many of you will be working on these projects over the next few days. We're really happy that we had 2 CTP-related publications published within the last few months. One is by Sarah Ringgold and others, which basically goes through the rationale and design and idea behind how the CTPs were created and the methods behind them. And then Peter Nigrovich and others published a paper that kind of talks about how we could analyze the CTPs being used in a comparative effectiveness study in an observational way, such as the FROST study. The CTP Advisory Committee was also formed this year, headed up by Emily von Schaven, and there is also a CTP guidance document that is available through the CARRA website that goes through the different steps that you should do in order to create or obtain consensus for having what we are calling CARRA CTPs. Just want to say a few words also about the CARRA AF Intramural Grant and Award Program, which is a very important facet also of what we do. So this is a program that we started 2 years ago, and which we're continuing to expand in terms of numbers of opportunities and funding. And currently we've been able to fund 36 small and 4 large grants, as well as 5 publication grants, 11 early investigator awards, as well as a fellow grant, which is going to be new this year. And we have awarded 8 internship and other career development awards. Please, the poster session is going to have information about many of these projects, so I hope you take the time to visit the posters and talk with our grant recipients. And I also want to point out that we also formed an official scientific review committee, which is graciously chaired by Terry Moore, and I want to thank him and all of the volunteers who make up the committee to help review all of these grant applications as well as award applications. Lastly, but not least, just want to say a few words about patient engagement in CARRA research, which has become more and more important over the last few years. And I think that you can see, you will be seeing in terms of the participation of patients and parents, hopefully in the annual meeting that has continued to grow. We have our partners, PPRN, which is a patient-powered research network that we work with the Arthritis Foundation, CureJM, the Lupus Foundation, and PRCoin to increase patient engagement in research and the ability for patients to participate in research. We are increasing our presence at the Arthritis Foundation JA conferences as well, and performing more research projects within the conference itself. And this year, we are working with the Arthritis Foundation to have a patient-focused drug development or a PFDD meeting in conjunction with the JA conference in Washington, D.C. At the FDA. And this is something that really, the FDA really encourages us and the Arthritis Foundation to really get the patient voice in helping understand what patients want and need in terms of what kind of outcomes are important to them and how studies are conducted. I already talked about the Rheumatology Learning Health System project in which we will be engaging in hopefully patient co-production of healthcare. We also have a project called POWER, which stands for Patient-Parent Perspectives on Why to Enroll in Research. And this is an idea that kind of came together through the Promote study team, thinking about why patients don't enroll in studies as much as they should. And so they got together a team of investigators, patients, and parents to try to come up with various viewpoints about what, how we can improve this, and are creating actually a video that we can show to our patients about why it's important to participate in research. And of course, we're embedding patients and families into the research process in many other different ways. We have patient partners in CARRA studies who help us develop patient-facing materials. They also are helping us translate some of our articles and materials so that it's understandable to the layperson, and helping with dissemination of results in that way as well. And we have also started to involve patients and parents as part of the grant review process. So what are we looking at for the future for CARRA? We have been very heavily involved over the last 6 months or so in streamlining our governance structure and developing a viable strategic framework for our organization for the next 3 to 5 years. And you're going to be hearing about some of those ideas at the CARRA business meeting. And it will help us to really strategize and prioritize the work that we want to do and focus on for the next few years, including making the patient and family voice central to our research, increasing member and site engagement, which is very, very important to CARRA as an organization to be successful. We want people to increase the use of CARRA registry data, and we want to perform more clinical trials, more comparative effectiveness studies, and pharmacosurveillance studies as well. We want to expand biospecimen collection, translational and basic research, as well as increase global collaborations in both education and research. And we also want to be able to impact the conduct and design of clinical trials. So actually yesterday, we met with members of the FDA, EMA, and pharmaceutical company representatives, as well as several pediatric rheumatologists from Europe and the UK to talk about the problem that's facing us in terms of being able to enroll patients in clinical trials to register products for JIA. It was a successful meeting, and you'll be hearing more about it in a publication hopefully soon. But it really opened everybody's eyes to what's possible in doing clinical trials in pediatric rheumatology. And lastly, we really want to understand the overall impact of CARRA's research on our patients and in the pediatric rheumatology community. Lastly, I just want to mention that there's some leadership transitions that will happen in July of this year. So I will be stepping down from being president to past president. Rob Fulbrigge is going to step up to become the president of CARRA. Emily von Shaven is going to step up to be the vice president. And Bob Colbert is going to become our new finance chair. And last but not least, Laura Schamberg will rotate off the the executive committee after 8 long years. So I really want to thank her tonight. I'm going to have a lot more to say about her, probably in the future, very near future, but really want to officially thank her for all her years of service. Thank you, Laura. So I want to thank the Annual Planning Committee, of course, because without them, this meeting would never have happened. And here are the chairs, Stacy Ardoin, Adam Huber, Laura Lewandowski, Jay Mehta, and Laura Schamberg. And also all the pre-meeting organizers, as well as GE Healthcare for providing the ultrasound machines for the ultrasound course. And all of the leaders of our 34 work groups that are working very hard, have been working very hard, and will be working very hard over the next few days. Really want to especially thank our patient and parent ambassadors, Vincent Del Gaizo, as well as Sue Schrant from the Arthritis Foundation. They have spent many, many, many hours putting the patient and family program together for this meeting. And I also want to thank, of course, our meeting planning staff, Nicole Doms, Brian Dragon Jones, and of course, Kelly Miskowski. So thank you all. These are our annual meeting sponsors that we would like to thank, and of course, our partners and funders, especially the Arthritis Foundation. I just want to take a moment here to thank the Arthritis Foundation for their partnership, because without their partnership and help, we would not be able to do many of the things that I talked about today. And I especially want to acknowledge the presence of Ann Palmer, the CEO of the Arthritis Foundation. Ann, would you please stand up? And also the other Arthritis Foundation staff that are here today. Thank you. You stand up. Stand up so everybody knows who you are. Thank you.